Erlend Berg, Mike Gibson coming to you live from AHA 2022. I got to say, it's about 25 years ago when I was involved in looking at this question of an early invasive strategy. It was a trial called Tactics TIMI 18, and we found that among troponin-positive patients, an early strategy was better than a conservative strategy. You've now looked at the elderly, the very elderly. Elderly keeps getting older for me, by the way. You looked at the people over 80 years of age and compared an invasive versus conservative strategy. What did you find?
Well, in the After 80 trial, which is a randomized controlled trial, we found that an invasive strategy in the very old reduces the risk of the primary composite endpoint of myocardial infarction, need of revascularization, stroke, and death, both in a short and a long term. This is a very long-term follow-up. We have already published the one-year results, and we see that, okay, in the end, the patients die, of course, because it's 10 years of follow-up. So they both the curves in the Kaplan-Meier plot meet in the end.
Yes,
but they have a positive effect of the invasive strategy.
And was there any difference based upon men or women? You know, is an 80-year-old the same as a 90-year-old? Is the same as a 95-year-old? Did you see any modification of this by age or gender?
No, we have almost equipoise between the sexes, and there was a similar effect in both men and women from an invasive strategy. But with regards to age, we see that the beneficial effect of the invasive strategy diminishes with age, and at about 90 years of age, the hazard ratio crosses 1.
Yes. Yeah. Well, what's the take-home message? Should we still be intervening in the elderly?
I think so, yeah. Our message is that the elderly, they benefit from an invasive strategy, but only in terms of reduction of myocardial infarction and need of new revascularization. We can't say that there's no difference with regard to mortality, and it doesn't seem to influence cause of death.
Great. Thanks for joining us today.
Thank you.
And thanks to all of you for joining us here live from AHA 2022.